Hi mamas, today I'm going to teach you all about perineal massage, what it is, why it can be helpful for your birth, and then how to do it at home as part of your essential birth prep. There's a lot of research around perineal massage that shows the benefit, especially for first-time mums, in decreasing the risk of more severe perineal tears. We know that tearing of the perineum can occur in childbirth, and it's often graded. So first degree would be just into the skin, second degree starts to impact the muscle, and then a third or fourth degree can start to reach down toward the anal sphincter. And that long term can have some serious implications for bowel control. So what perineal massage can help with is actually decreasing the risk of those third and fourth degree tears, as well as helping to shorten somewhat the length of your pushing stage of labor, which is a lot of work. So if it's a little quicker, that can be nice. As well as improving the comfort of the healing of the perineum postpartum. I find it can also be really helpful to allow you to map out where the perineum is, where the vagina is. I know that sounds funny, but when you're in labor, if you're able to further guide and direct baby down toward the vagina as you're pushing, that's going to lead to more effective pushing and better awareness of how to relax and keep that pelvic floor soft, even when things maybe aren't feeling so comfortable. When you're doing some of this perineal massage, it can create a little bit of a stingy or burning sensation. That is normal. And again, I find it can be helpful because if you are experiencing the stretch as baby's coming down during birth and you can recognize it. So you've done this stretch leading up to birth. When you're feeling that similar sensation in labor, instead of going, oh, that doesn't feel very good, I'm going to tense up, you can remember, oh, I know what this means. This means baby is almost here. We're so close. And instead of tensing, I'm going to really intentionally soften and relax the pelvic floor to allow baby to pass through as smoothly as possible. So, perineal massage, what the evidence is showing now is that 1 to 2 days per week is actually more beneficial than doing it every day. So you don't need to do a ton of this to see some benefit. You can start generally from 35 weeks of your pregnancy. You don't need to do it a lot sooner, but from 35 weeks, 1 to 2 times a week, and either doing it yourself or getting your partner to help you. A pelvic floor physio can also give you some guidance and demonstrate on you to see how that feels. So then you can practice it at home, or you might go to your pelvic floor physio to have them do it for you, because logistically, it does get a little awkward when the belly is a bit bigger. So I teach 2 separate components to my perineal massage. There's the massage around the perineum itself, so on the skin externally. And then I also teach some gentle stretching and pressure around the entrance of the vagina. So when you are doing this, if you're doing this at home, you would want to be in a comfortable position, relaxed as much as you can. So if you're on your bed, lots of pillows propped up behind you so that you can reach, or just pillows propped up so that you're not totally flat and you're not feeling breathless at all being on your back. Some of my ladies will do this in the bathtub where the warmth of the water is already helping to relax the muscles. My midwife, I recall, she suggested doing it on the toilet. So you can be sitting up, you can reach, and then you can actually have space to get to the perineum in a more logistically friendly angle. The key points would be just good hand hygiene. We know that the vagina is not a sterile environment, but we don't need to introduce anything unnecessary into that space, especially at this time. So make sure your hands are really clean. Make sure your nails aren't too long. We want trimmed nails for this. And then using some kind of natural oil or lubricant. So a lot of my ladies actually prefer olive oil. In Australia, there's this beautiful brand called Olive and Bee, which is a natural lubricant literally just made from olive oil and beeswax. I often get my mamas to use that one. Or if there's a lubricant or something that you know that your body's comfortable with, that would work as well. So you can start, if you're doing it yourself, your thumbs will be easiest. You can place the thumb onto the perineum and you start by gliding downwards. So stroking down from the vagina towards the anus. Sometimes it feels a little slippery and I prefer to go side to side while still moving downwards. That can be a nice way to work through this thicker central tendon within the pelvis. You can also do some diagonal glides, swapping hands as needed to reach each side, and then even going directly out to the side can be a nice way to massage these tissues. If you can reach with two hands at once, you can absolutely do that together with both hands and spending a few minutes there. This should feel relatively comfortable. It might be a little tender, a little sensitive, and if so, then just start a bit more gently. And over the weeks, as you get closer to your due date, you might be able to add just a little bit more pressure. But we should never be causing or leaving you in pain afterwards. Okay, and then when we come to the entrance of the vagina, we can do a little bit more specific investigation or stretching there. So pretend that this is the entrance of the vagina. Anywhere in the lower half is usually where we need to encourage a little bit more mobility. Most women will experience more tension directly downwards. So we call that 6 o'clock. If 12 o'clock is straight up, 6 o'clock's down. You can work anywhere from about 3 or 4 o'clock and going across to 8 or 9 o'clock. Again, if you're doing it yourself, you would use your thumb. So inserting the thumb into the vagina and gently applying a little bit of pressure towards that 3 or 4 o'clock. So sinking into the tissues enough to feel a bit of a gentle stretch or a bit of that firm pressure. It may start to feel a little stingy. We don't want to push through intense discomfort. So maximum 5 out of 10 pain would be the most that you'd want to go. So pressing into that 3 o'clock, and then I investigate all the way around. So 3, 4, 5, going down towards 6, and just taking note of any areas that are feeling a little more sensitive that you might want to give a little more gentle attention to. And then if you're doing it yourself, you would need to swap hands, thumb going towards the other side. So 9, 8, 7, down at 6 again. And at each of those points, you might hold for about 5 or 10 seconds, just sinking into the tissues, breathing through it, encouraging the muscles to soften and relax as you do so. And then if you're feeling up to it, you could also do a bit of gliding. So again, with that one hand, starting around 6 and then gliding around and outwards. Same on the other side, starting at 6, glide around and out. If you can reach with 2 hands and get 2 thumbs inside the vagina, you could do more of a U shape together. And if you've got somebody helping you, you could have them use 1 or 2 fingers to do that similar stretching. Again, just paying a little extra attention gently to any areas that feel a little more tense or a little less supple through the perineum. So all in all, I would start with maybe 4 minutes total. If it's feeling okay afterwards and you think, oh, I could do a little bit more next time, you could gradually build that up to 5 to 8 minutes, as much as you feel able. So as a bit of a summary, from 35 weeks, you can start doing this perineal massage. You would want to do it 1 to 2 times a week using some kind of natural oil like olive oil, The olive and bee is beautiful, or some kind of lubricant or gel that you know works for your body. And feeling that there's some awareness of having worked on those tissues afterwards, having a bit of stinging during is normal and okay, but you shouldn't be feeling really sore afterwards. Okay, if you have any questions, please drop a comment below. Otherwise, I hope this is helpful for you, and all the best.